Okay, and we're gonna start here by naming our workflow, and this is just the create patient portal account. Okay, now I mentioned that all of the patients go into that patient demographics form, whether they come in through the patient portal registration or you manually enter them. That's the first place that the patient needs to go. So that's the form I'm going to choose here. So it says which form should the workflow be based on? Okay, so it means which form in the system should this workflow start with, right? So what happens in the system that makes more things happen? So in this case, that's going to be the demographics form. Okay, you'll notice this is a big drop down. I don't particularly care to scroll through it, so I press F2 on my keyboard. Okay, and for those of you on a MacBook or on a laptop, you have to press your FN or function key. On my computer, it's in the lower left corner. You just hold it down and press F2, and then you can just search for the form you're looking for. Now this F2 search, it works through all of the system's drop downs. Okay, then I can choose demographics. You'll notice here I have things like on creation, which is what I'm going to work with. But Mary, what you might want to use is on readmit, okay, for your particular workflow. Okay, so you might have different workflows for on creation for a brand new person, or you might have on readmit if the client has a previous phase of treatment. Okay, we're just going to keep moving. If the action occurs multiple times, should tasks be duplicated? No, we only need to create the patient portal account once. And then we're going to say, is this workflow active? Yes, it is. We're not going to put in any rule effective dates, but if you have something that is a temporary kind of measure, then you can set those up here. Okay, you'll notice a filter button. In this case, we're not going to filter this workflow. It applies really to everybody that's registering. I want everybody to get a patient portal account. So we're going to leave this alone for now, keep it simple. Okay, and now we're going to come over here to step 2, and we're going to add tasks to the workflow. So basically, step 1 was very easy. We just said when a new demographics is created. Okay, if anybody has questions on step 1, let me know. I'm going to pause for a minute just to make sure everybody's caught up. Okay, we'll go ahead and come over here, add tasks to complete. This is where we're going to say create patient portal account. Okay, and we'll come over here to, whoops, the next action. So what action needs to be completed? So I have 3 choices here. Form action. Oh, Allie, I see you. I'll unmute you. Allie, are you able to tell us your question?
Hi, sorry, I was having technical difficulties. I just wanted to ask a question about the add filter option, because at our clinic, we are serving both community clients that we would create a portal for, but we also have a batch of clients that are affiliated with our hospice patients, where we may be checking in with them, and yet they're not. They haven't. We're checking in with them to see if they're interested in receiving counseling. So in those cases, we need them in the system because it alerts the clinician to follow up with them, but they may not be ready for the patient portal. So I was wondering if you could walk me through adding that filter. They would be clients that are assigned to a different group.
A different patient group, yeah. Okay, so I'll go ahead and mute your microphone if that's okay, and then I'll
Sure.
I'll back up a little bit and we'll filter this.
Okay, thanks.
Sure thing. Okay.